Officials in Bismarck have launched a program that aims to bridge the gap between emergency services for overdose victims and treatment for opioid addiction. KX News' Christina Randall is in the studio tonight with more on what makes this program different from the rest. Hi, Christina.
Good evening, Brooke. The Heartview Foundation, Sanford Hospital, and Bismarck Police Department partnered up to launch this new program. The program will allow those who have overdosed to connect with someone who overcame the addiction.
It is not an opiate crisis, it is an overdose crisis.
The nation has been battling the opioid crisis for decades. In the late 1990s, pharmaceutical companies reassured the medical community that patients would not get addicted to opioid pain relievers. And unfortunately, like many states, North Dakota is struggling to overcome the addiction.
And a lot of times things take a while to get to North Dakota, but this one, when it came hard.
The first time Bismarck started seeing opioid overdoses was in 2016.
We started keeping track of how many were happening, how many deaths are happening in 2017, and they've pretty much doubled every year.
Last year, Bismarck police know about 133 overdoses. There were a total of 19 deaths. Bismarck Police Chief Dave Drayevich says they will need the community's help to win this battle.
There's no way we can arrest our way out of this problem. It's not possible to do. We need help from people like Heartview, from Sanford.
The increase in opioid overdoses has prompted Heartview, Sanford, and the Bismarck Police Department to launch a new program.
So the goal is to stop people from dying. That's the goal. And oftentimes people are at their most vulnerable right after an overdose.
The city will be receiving $900,000 in grants over the next 3 years from the Federal Justice Department for this site-based program. The money will place staff from Heartview Foundation in hospital emergency rooms. What makes this program different is the program provides a peer support person.
Oftentimes the loneliness factor is what causes people to use in the first place. So having that stable person in their life, we hope will help.
Overdose victims not ready to commit to treatment will receive initial peer support services from Heartview and then be transitioned to community outreach provided by Ministry on the Margins. Bismarck-Burley Public Health is now partnering with the Heartview and the North Dakota Safe Council to provide free Narcan training. Participants will learn how to recognize an opioid overdose and how to properly administer Narcan.
Thank you, Christina, for that report. And to learn more about that training, you can head to our website, kxnet.com.